Hi, I'm Jodi Mitchell, Senior Director of Government Relations at WellLink Health Alliance, bringing you our September edition of Policy Points. This week, I was on Capitol Hill engaging with our congressional delegation with a quarterly update according to our advocacy priorities. We at WellLink continue to support sustainable healthcare financing mechanisms, support for our health workforce, and advance quality and driving innovation to support community well-being. As we approach September 30th and the close of our federal fiscal year, congressional leaders are faced with passing a continuing resolution as a temporary band-aid to keep the government operating until all of the funding bills can be passed, or we face a government shutdown. In addition, there are a number of critical programs that will expire at the end of this month if Congress does not act. We were pleased that the House leadership package released on Tuesday this week includes these healthcare extenders. This package could be voted on as early as Friday, September 19th. What wasn't included in the Republican continuing resolution bill was the extension of premium tax credits that help individuals afford health coverage through the health insurance marketplace. This provision was included in the Democrat package released on Wednesday, but it is unclear if it will garner support across the aisle. As additional provisions are added, further extending federal dollars, then leaders will need to look at other ways to make changes, which we call pay-fors. We are working to protect the 340B program from changes and urge Congress to reject site-neutral payment cuts. During our quarterly Hill visits, we also shared WellLink's efforts in emergency preparedness, where we are defending the hospital preparedness program from future cuts and supporting policies that help address the opioid crisis. WellLink Health Alliance supports easing administrative burdens and supports timely payment processes. When payments are delayed, patients postpone necessary services that lead to poorer health outcomes and greater long-term cost. We urge Congress to support the Prompt and Fair Pay Act. Through WellLink Group purchasing, we seek to ensure access to goods and services and avoid disruptions in supply chain. To that end, we support the MAPS Act and the Medical Supply Chain Resiliency Act. We have over 77,000 health care vacancies in Ohio. We not only are engaged in career development and pathways to sustainability, but we are also wanting to support and retain our current health workforce. We continue to encourage support for legislation that strengthens the healthcare workforce. This week, the Center for Medicare and Medicaid Services released its notice of funding opportunity for the Rural Health Transformation Program as a result of H.R. 1. This money will be awarded to states over the next 5 years. States have to apply by November 5th, and funding will be let by December 31st. Ohio has a positive track record for these types of collaborative approaches and has begun to meet with stakeholders to seek input about innovative, transformative, and sustainable programs to be included in the state's proposal. For more information about Ohio's efforts to respond to this funding, go to odh.ohio.gov/RHT. There is an Ohio survey of stakeholders that is open until October 3rd. Supporting the health of our communities is challenging in these times of uncertainty and volatility. However, WellLink will continue to collaborate, convene, and influence to be your link to elevating the well-being of people in our communities.